One very unique sign is lower abdominal pain or belly pain that doesn't want to go away. This pain just continues in there and it doesn't go away. No matter how you try for it to go away, it means something is definitely wrong. So number one is belly pain. Next is vaginal bleeding. Any vaginal bleeding that is more than spotting. Spotting is a tiny bit of blood that can be spotted in your panties or when you wipe your vagina with a tissue. It's not supposed to be plenty blood. So any vaginal bleeding that is more than spotting and for a long period of time, maybe more than a few days, it's cause for alarm. You should be concerned about it. Next is what we call edema, which is extreme swelling of your hands, feet, or your leg. This is an accumulation of fluids in your body and it's not actually a good sign. It shows something is wrong. Accumulation of fluid in pregnancy is actually okay. When it becomes extreme, then it is a cause for alarm. Next sign is tightness in your chest or difficulty breathing while standing or while lying down. It's a serious cause for alarm, and if you have difficulty breathing in pregnancy, you should see your doctor. The next sign is increased temperature. If you have high temperature when you're pregnant, is actually not a good sign. Like temperature that is equal to above 38 degrees Celsius is actually not good. Already when you get pregnant, your temperature automatically, your basal body temperature automatically increases. So that is not a good sign at all. Number 6 is severe morning sickness, a condition we call hyperemesis gravidarum. It's a condition where you have severe morning sicknesses. It could be tiredness, it could be irritation, it could be other symptoms actually, but you should be able to do a little bit of your daily chores, one or two things you used to do before you got pregnant. So if it reaches that stage where you can't do this, then it is a cause for alarm. I have dizziness and fainting, which could be a sign of low blood or even low blood pressure. Yeah, you should actually check that out with your healthcare provider. My number 8 is headache. Any headache that is persistent and doesn't want to go away is a sign that something is wrong. So yeah, you should check it out. 10 is group test, the 3 cardinal of preeclampsia, which is proteinuria, edema, and high blood pressure. If you have these 3 signs, it's actually a fetal sign, so you should check it out. Proteinuria, high blood pressure, and swelling or edema. Now I'm going to talk about what you could do to avoid complications, to avoid all those things I have listed below. One and very important is to attend regular antenatal checkup. Attend regular antenatal checkup. Follow your midwife. Listens to what she says. So yeah, attend your antenatal, follow up with your midwife, have your midwife's number, call her if you have any questions or if you are experiencing any difficulties. Second is eat balanced diet. You mustn't eat so many things, but eat the right thing at the right proportion. Make sure your diet contains the things you need to give proper nutrition for you and your baby. It mustn't be plenty food, but eat the food that is rich in vitamins, enough to supply you and your baby the required nutrients. Then your weight. If you know you are overweight or you're not under the recommended BMI, you should actually lose weight because it also has effect on the baby. Avoid alcohol and smoking. It could lead to baby defects. It's very important you try avoiding smoking or alcohol and reduce your caffeine intake too. Then finally, treat all underlying conditions or illnesses before you're pregnant. It's very important that you do this because those illnesses interfere with your baby and the pregnancy period becomes very traumatizing. So if you have vaginal infections, if you have any underlying health infections, UTI, you should treat it before you get pregnant. If you're watching this video at this point and you're preparing for your delivery, congratulations, dear mom. I pray the good Lord guides and protects you and you would go home with your bundle of joy.